Hello, everyone, and welcome to another episode of Let's Get Real with What's Wrong with Healthcare. This series is designed to try to stimulate conversation about the difficulties that the average American has in um, accessing and obtaining the healthcare that they need, and the different things that pop up that make it very challenging to receive what we need. This particular episode is regarding the hidden healthcare costs, those surprise bills that we receive. These problems of getting the hidden bills or the surprise bills is that it has potential to cause severe financial problems, including bankruptcy for the average middle class American. 40% of Americans cannot cover unexpected expenses greater than $400. A survey of the West Health Gallup poll showed that $88 billion were borrowed in 2018 for covering medical bills. And according to the American Journal of Public Health, 59% of bankruptcies cited healthcare expenses as the cause for going through the bankruptcy process. Part of the problem is 45% of Americans under the age of 65 are currently underinsured, and 13% of Americans under 65 are uninsured. This may sound like alarming numbers, but prior to the Affordable Care Plan, there were 40 million Americans who were uninsured, and after that act passed, that number dropped to 20 million. 2018 was the first year that we saw the numbers go back up where more Americans were uninsured. Part of that is certainly due to the cost of receiving health care and getting the insurance, but it also is a problem that there's no longer a mandate that everybody prove that they have health insurance. So what are those surprise bills that people get? Well, one of them could be the use of an out-of-network provider. When the provider is in-network, our costs are maintained at a very low. It usually is just a copay that we have. However, every now and then we have an out-of-network provider that is kind of snuck into our care, and it could be that it's during a hospitalization or a surgical procedure that you have planned that one of the providers that participated in your care was out of network and it was not disclosed to you prior to the procedure. The other area of concern are surprise medical billing practices. That could include billing for services that were not rendered, a duplicate or a wrongful billing, upcoding or unbundling. Upcoding is when perhaps you had a certain treatment and it was billed at a higher level for a higher level provider, and we'll go into that more with our guests. It could be an unbundling of a code. For instance, there's two codes that are used when you receive an x-ray. There is the technical component of actually taking the x-ray, and then there's the professional component of reading. And sometimes those codes are unbundled, and that usually results in an increase in your bills. There's still some unlawful collection practices. There's inappropriate coding that could be used, and it could be wrong evaluation and management coding used. Whether or not you are a new patient or an existing patient, there are different levels of coding an office visit. Those are called E&M codes, or evaluation and management. And those are supposed to be billed based upon several factors, some which could include the amount of time that is spent with you, the level of history taking and examination, how difficult medical decision making may be. And we all know in the end how much time a physician spends with us, so that's a good place to look at for upcoding, is using wrong E&M codes. Part of the problem with medical billing is it's taken out of the hands of physicians in today's community. It used to be that our physician controlled what was being billed, and now this is done by a billing department, not even on site or in the physician office. If you asked your physician about the billing codes, they probably couldn't give you much information. And certainly it doesn't allow the doctor to even know what is being billed to a patient. A facility use fee, these have been around for, gosh, almost a decade, and it's basically a tack-on fee to your bill for the use of their facility. Which basically means that they're asking all the patients to cover their overhead or their rent. And insurance companies do not cover facility use fees. And you can call the health system that you're receiving your care through and ask which facilities tack on a facility use fee, and then try to avoid those facilities so that you don't have additional healthcare expenditures. Another kind of sneaky tactic is the use of a hospital license in the billing practice. For example, you may see your internal medicine physician and receive an EKG, and that cost may be typically $150 in that office. And then you get referred to a cardiologist. And a lot of health systems now keep their cardiology department, they have special centers for them. And you may have another EKG, but the cost of it now from cardiology is $350. Well, why is it more expensive to get it there versus where you had it previously? And it may be that the cardiology center is on the same grounds as that system's hospital, and they're using their hospital license to bill under. And that's kind of a sneaky way that inflates your bill that could cost you more money. The other ways that you could get surprise bills is non-approved services. Certainly before you have any kind of procedure, you should request from the billing department whether or not that service has been approved by your insurance. That's called utilization review. And you should always know prior that you have been approved for their services so that you are not going to be turned around and billed for it, because you typically, in the intake process of signing forms, you sign that you are ultimately responsible for a bill. So they put the responsibility on you that you know whether or not a service is approved or not. Medicare, it's a little bit different because if it's a non-approved service, they must disclose that to the patient and have them sign a waiver showing that they know that this service is not approved and that they'll be billed for it. Non-covered services. This is when your health insurance is electing not to pay for certain services. It may be because they're considered experimental. It may be that it's considered elective or cosmetic. And again, you should find out ahead of time by calling your insurance company to verify whether or not a service that you would like to have is a covered service or not within your particular plan. Every plan is different, and one insurance company may cover it and another may not. So it really, again, is put into your responsibility to know whether or not it is a covered service. Other areas of non-covered costs that we typically do not consider when we're factoring the actual cost of healthcare is transportation costs. It may be that we live in a rural area and we have to drive pretty far to receive health care, or perhaps you're getting care at a regional cancer center which is out of town for you. In that case, there may also be lodging associated with that trip to go receive health care. Currently, health insurance plans don't cover in-home caregivers to assist people with personal care and for activities of daily living. Long-term care insurance plans, they typically cover these services, but not a traditional health plan. The other thing we don't often consider is lost income. Perhaps we have to take a paid day off if we have those available to us. People who are hourly workers typically will lose income for going to doctor's appointments for themselves or for a loved one. Some alarming information has now been shared by a crowdsourcing website called GoFundMe. The CEO, Rob Solomon, has revealed that between the years of 2010 and 2017, 1/3 of all fundraising requests on this site were medical fundraisers. And his statement when revealing this information was that when they started this website in 2010, they never anticipated that this site would become an alternative to health insurance.
For today's episode on hidden costs, we have two guests, Kevin and Melanie, both who have experienced unexpected surprise bills. And we'll go through what the situation was and how they attempted to resolve it. So, Kevin, welcome to this episode. Thank you so much for participating in this. Why don't you go over what your surprise bill was?
Well, my first surprise bill was when I was 50, going in to get my first colonoscopy, or at least it was a physical, and that was one of the concerns that I had brought up to the doctor at the time. And I've had some digestive, issues in the past, diverticulitis, a very light bout, and so I just want to make sure I'm being thorough. And I knew, according to the Affordable Care Act, that I would be entitled to that at that benchmark. So he had agreed, and we went ahead and scheduled it, and I went through the process, and then a month later I got a bill for it for well over $1,300, which I was really surprised, knowing that that's one of the things that's covered. And really, primarily, one of the main reasons that I went with an HMO, believing that Kaiser would be a place where you would not have a lot of those hidden costs or outpatient sort of things you might see elsewhere.
HMOs, you're paying your monthly maintenance fee, so to speak, and then you have a copay when you go see your doctor or if you're having a procedure. And so typically you wouldn't be expecting on the back end that you are going to have to pay more than that, because that's pretty much how HMOs work.
Right.
And so when you get this surprise bill, aside from being surprised, did it cause any other emotion for you?
Oh yeah, everything under the gamut, of course. Anything that's a surprise bill, whether it has to do with your animal or your own health care or something with your house, anything a surprise to your budget is very uncomfortable. So, the first thing I did was call them up, and they explained that, basically, when you have a concern about something and you bring it to the doctor's attention and it's not something that they decided on, then generally the cost is passed on to you. So I learned a lot that day about the Affordable Care Act.
So one of the problems in healthcare is that you have different terminology that gets used. Mm-hmm. There is prevention, which is what the colonoscopy is supposed to be. And then there's diagnostic tests. And so the coding gets extracted for screening would be what should be covered in the Affordable Care Act. And then if it was for diagnostic purposes, then it would be upcoded, and it may not be covered as a preventive service. And so it sounds like this is a situation that you probably got caught up in, was somebody coded it not under what you were due at the age of 50, at least according to the United States Preventive Health Services Task Force, states that all people at the age of 50 should have a screening colonoscopy. And that, what I understand is your doctor didn't order that at 50, and so on your visit you requested that you have
Yes.
this done. But that's not how they then billed it.
Right, exactly. To your point, she explained sort of how that works, and that was my rude awakening about how medical works and the billing, and whether you bring up something which looks a little like you're asking for it, or whether the doctor brings it up as a normal part of that particular visit. So in the end, she explained you can write a letter and ask them to review it and take a look at it. And that's exactly what I did. But you can imagine that's all your time and your attention. You're stressed about it. You don't know the outcome
Writing
yet.
the right terminology that will get them to pay attention to what the issue is, that you put it in the right wording.
Waiting a month to hear the outcome. All along, you know that you're saddled with that bill that was unexpected, that might have gone to a family vacation instead. In the end, they ended up sending back a letter saying they agreed with me and they removed the charges. But it's a lot to go through. It's something that one doesn't educate themselves on. I can promise you, I don't know anyone who does, when you go to the doctor. And it's difficult at best to understand what you're paying for that day when you pay your copay and what you're going to see a bill for later down the road. And I had another example just this last month. I went into the doctor. I'm 57 now, so my biggest concern in Southern California is skin cancer. We get a lot of exposure despite the fact we use sunscreens. And I wanted the doctor to, and nowadays I use semantics. You hate to have to do this when you go to the doctor, but I use things like, so that I'm not bringing it up and I'm not asking for additional services, I have to play the game of, I'm here for a physical, and I would like to believe that a part of a good physical for someone 57 living in Southern California might be to check my skin, make sure there's nothing cancerous. And you feel like you have to say this. Mind you, I'm not asking you to do it, but you might think that it would be a good idea since I'm here.
So without knowing what your billing issue is, just hearing what you're telling me right now, if you ask for a physical, they are likely to now upcode you and charge you for a physical. The key word nowadays is you have to ask for your annual screening visit. And they leave so much up to the consumer now that you're supposed to know what the difference is, and we don't know these differences. And so I do know, that you can get caught in this billing situation that you asked for a physical, which is a different semantic or code than asking for your annual preventive visit.
Right. And consumers or Americans, we're not going to know the right terminology to use. We're going to use, what we think it's called, or, what we think we should be entitled to. And I just know at bare minimum there are things you're there for, and they want you to bring to their attention anything you're concerned about.
That's good medicine, right?
And they'll tell you that, and it is. We all want to take care of ourselves. We see too many of our friends die young over things that are preventative. But at the same time, it's like a running meter, and you know that every concern you bring up is going to be ka-ching, ka-ching, and it's not like it used to be, and it wasn't like this in the past.
So one of the ways that billing works, it's using CPT codes, and the CPT codes for a physician visit are tiered based upon the time they spend with you and the complexity of the medical problem, as well as the potential for additional testing and other measures. So it's decision making. And so you're right that the more things you bring up in that slotted time, they can bill for higher and higher fee codes based upon that time spent, the complexity of the problem, the diagnosis. And so what, I take it you got another surprise bill.
I did. So I went in and I paid my copay of $75 that day, and that leads people to believe, the patient to believe that, well, I'm paying for my visit today, I'm pretty much covered. You're not prepared for the surprise bills you're going to get about everything they do every step of the way. So of course I get a bill, and it's got little things like doing the skin shaving and doing the biopsy and sending it in and everything else. And then to the end, even though there are some shared cost and unshared, I ended with another $339 that I didn't expect. And again, it's not something you'd expect when you go to Kaiser, because it's an HMO.
Correct.
You think about a lot of things under the roof right there. So yeah.
And so, prior to these procedures, which it sounds like they found some suspicious skin lesions, and so they did the correct thing, which is they wanted to take a biopsy to make sure, because there's basically 3 types of skin cancers we're concerned with: basal cell, squamous cell, and melanoma. And melanoma is one that can kill you rather sooner than later, versus the first 2, basal and squamous cell, that are slow growing and can take a long time to cause bigger problems. They want to know right away, do you have the big bad one of melanoma? Did anybody go over with you, aside from telling you what the procedure was? I assume they consented to you for the procedure, but they didn't go over the financials and get your consent for what your shared costs or additional costs would be.
No, that conversation never takes place. And honestly, if I were going to ask that of the individual that checks you in and accepts your payment, they are not educated. They wouldn't know those costs.
True.
There isn't anyone on site, unfortunately, that could give you those costs. And I firmly believe that even if I had called membership services, if I'd asked a number of different people, I would have gotten a number of different answers. It's very hard to get the right answer in advance.
If you would have said, I don't want to surprise Bill, I would rather know ahead of time. If you would have taken the time to do that, and then you would be having to reschedule for the skin biopsy, which means it would be probably another $75 copay to you. So it's now more time off work, it's more copay money, and really a very inefficient way to try to just find out what is my cost to me.
Right. And I think that one of the reasons it's such a surprise to Americans going to the doctor, is because you do go many times and you just pay your copay and you see no other bill in the mail. Or you show up, for your preventative things like a flu shot, or even the measles and rubella and other shot that I recently got just because I wanted extra protection. And then now recently the, what's the other one?
The shingles.
The shingles.
Yes.
And, I'm told that those are all free services. Those are available. So you don't know when you're going to get charged and when you're not. And the minute you don't get charged for some things, you get comfortable believing it's okay to come in for other services that you get the surprise for. So
well, it's not a very comfortable place to be, not knowing what you're going to have no cost for and what you're going to have a little cost for and what's going to be like a big cost. We all assume we're going to pay a copay when we go in, but when we get that bill, that may be, the difference between, like you said, going to a dinner out or going to a movie, or for some Americans that has a much larger impact than others. And so it's sort of an unlevel playing field. Would you think that's a good way to put that?
Because there's so many places in my life that I can go and get service either from my car, and they're going to look at it and they're going to be very, very clear about what they're going to have to do and what the costs are going to be before they do anything to it. So at least you're informed. It takes that anxiety away. Somehow you get to make the decision. It's not just happening to you. And the same thing when I take my dog to the vet, who's an elderly dog now, and I spend a lot of money on the dog. The vet knows off the tip of their tongue, right there in the room, what these procedures cost. But if you were to ask your doctor or anyone at your medical facility, they couldn't give you these costs. And we spend so much on ourselves, of course, and then our pets, that it's just one world's got it figured out and the other one just doesn't.
So they're in Medicare, they do have a rule that if it is a non-covered benefit, that they must come and verbally disclose that to you prior to any services being given, and you have to write an acknowledgement that you received that information. So it's sort of like a little more transparency. one of the reasons why I'm doing this series is because we are heading into a large election and healthcare becomes part of it. And it seems like the only thing that's being discussed is costs. And nobody's talking about, what it's like for us as consumers of healthcare. So if you could kind of wave your magic wand or actually have the ear of an influential politician, what would be some of your solutions to this problem that obviously is not just your problem, it's an American problem?
Well, I believe that I'm a firm believer that the way it was established is that if everyone has to participate, which I know people think that's un-American if you make people have to do something in America, but the truth is when they get ill, they're a cost to the system anyway. It's going to happen. I know we're all alleging in our own mind, but we're going to get sick. There's something going to happen. So I believe that you do have to have a mandate that everyone participate on some level in an insurance plan, and if you have to give subsidies because of income levels, that's fine. I think we've already doing that. So I think the only way you bring down insurance costs is everyone's got to participate. So that's got to come back.
What would you like to see them do to avoid potential financial devastation to you or others by getting those surprise bills?
I'd like to see them make it sort of mandatory that people understand what the cost is when you arrive at the doctor's appointment. Shouldn't be that difficult to do. I mean, when you call to make an appointment, you give them the reason for the appointment. They should be able to give you some sort of reasonable estimate, even a disclaimer that says this is only an estimate and there may be things left out. But it reminds people that they need to start thinking about the cost and they're prepared for it. There's some expenses they may choose to put off so that they can afford this upcoming visit. And I think there's a lot that they can do to bring down the cost of healthcare in this country so that people can reasonably afford it and have more covered by your simple monthly premium instead of having everything be a la carte.
Years ago when we had the 80-20 system, and even before we ever had insurances involved, you were seeing a private physician probably in what we call a single shingle business where they're by themselves, but they had a fee schedule and they would go through and tell you what your fee was likely to be. And certainly we can all understand in an emergency situation that things are being done to save your life, that they're not going to stop to say, hey family, here's your estimate, because they don't know. I mean, they're in an emergency situation. But it seems that going to an office, there should be at least maybe a reasonable expectation about what the cost may be to you and whether or not you're going to incur additional charges based upon what is done. Certainly, we have, if we're going to talk regulations, and you're coming out of banking, we have had regulations in banking that what your fees are up front. And right. There is billing, even though we don't have those single office physician offices anymore, they're big groups and they're big systems, they still have a billing department where it seems that they could key in a certain keystrokes and find out reasonably expectation of what your costs may be.
Right. We've had to adapt to more than that in America over many different things. So I absolutely think they can do that.
So right now, the way the system is, would it be fair to say that there's more responsibility on the consumers of healthcare to know?
Absolutely.
And I mean, my question is that a reasonable expectation in the way that medicine is set up today? Is that something that the average consumer would know where to start in asking those questions?
Yeah, I think there's a lot that we still have to learn as Americans. I don't think we ever thought this was an area that we had to pay that much attention to. But as soon as you start having some medical expenses and some things like that, you're kind of having a rude awakening, and you're having to learn that this is another area of my life that I have to take more responsibility to ask the questions, to understand the co-pays and what's covered and
The
what's
terminology.
not, and all the terminology. And it's very easy to look at it all. They put it out there, but it's meaningless to us because it's so complicated that there's a whole bunch of terminology to understand, and I'm looking at it this year much more closely.
Well, you're kind of forced to have to look at that closely after receiving a couple of surprising bills because, one, I mean, I'm going to personalize it for myself. I would feel duped. I would feel like, gosh, why didn't they tell me this beforehand? And oh my gosh, that's a lot of money. When you have fixed monthly expenses, and where am I going to rob Peter to pay Paul to meet this bill? And so there is a lot more responsibility being placed upon the consumer to know. But even, your explanation of benefits. I mean, would you know where to start in your explanation of benefits to
No.
tell you what billing code they use?
No, you can look right at it like a statement at the bank, and you don't really understand what you're looking at. You just don't, because I've already reviewed it.
So when you got these bills, did you call the insurance company first for an explanation, or the billing department of your health plan?
The billing department of my health plan.
And do you feel like you got a satisfactory answer, or did you feel like you had to go, to the insurance company to help resolve this?
The first one I most definitely did. This one, they gave me the answers. I wasn't happy about them, but yeah.
There you go. You have a bill that you weren't expecting to have, and your choices are to call the insurance company or the billing department of the health group that you go to. There's writing letters of appeal, and there is a bit of an art to writing those letters of appeal to make sure that you are explaining the problem succinctly so they know what they're looking at. And then, there's really, after that, if they say, sorry, you still owe it, you don't know, you end up paying the bill, but you probably still have that question in your mind of, well, why am I responsible for paying for something that I didn't know was my responsibility?
Yeah. And I think as consumers going forward, in the past, I always felt like making that very large monthly medical premium was pretty much covering me, and I was in good shape. But as you get older and little things come up and you find yourself going to the doctor to get something checked a little more often, I'm starting to get to the point where I believe you've got to tell yourself that's not it. Your monthly premium is just a pass go. And every time you go in, there's going to be money spent, and you're going to get bills in the mail. So I think we all need to start setting, $2,000 and $3,000 a year extra aside in a separate savings account just to pay your share of these increasing medical costs.
That's a great suggestion, because we already know that most Americans don't have money for unexpected expenses. And basically, with your experience, you're telling us, well, why are we thinking that's an unexpected expense? We have to expect that we're going to get these surprise medical bills because we don't know what they're charging us.
Right, exactly. And I think in the past, we always felt like the medical premium we pay monthly would cover these things, and it's just not the case anymore. And I think that's why it's such a rude awakening when we get these bills. And I'm just coming to that conclusion because it's the first time in my life I've had a little more serious things taken a look at, and I've had a chance to see what my share of that now is going to be, and how it's written up. So
well, and I would imagine you coming out of banking, that you have your finances very organized, and we all have to budget what our monthly or annual expenses are, and in this case, that's got to drive you crazy a little bit, that you don't really know what you should budget for.
Right, right. But I'm truly believing that it's at least an extra $2,000 a year people should put away. Because when you count on it and you plan on it, you don't have to like it. But if you've planned on that and you've allocated it and set it aside, at least now when those bills come in, you can say, well, at the beginning of the year, I acknowledged there would be some of this. I'd hoped there wouldn't be, but I did plan for it, and now there's the funds, and I'll go ahead and send it in. Makes it slightly less painful. I don't think we'll ever get used to it, and I hope they fix it.
So some of our takeaways from learning about Kevin's situation is, one, don't automatically pay for the bill right away. Call up the billing department or the insurance company and ask for an explanation of why that was not covered and what your possibilities of appealing that may be, and writing that appeal, especially if that's going to make a financial strain on you. You can also negotiate that if it's come to the conclusion of, well, yeah, that is what it cost you to do. And then, as Kevin is recommending, that you put aside a little extra money, if you can, to go towards those unexpected expenses. But what I'm also hearing from my guests today are that they would like more transparency within the healthcare system, that if they're not going to volunteer that information, we hate to see more regulation, but it would be only fair that we would know up front what our costs are. And certainly we're all reasonable people, that if you give us a range, we can live with a range. But not knowing what a bill may be can be quite devastating to an individual or a family. And so that would be a long-term solution for fixing the system, is that you would be given an estimate like you have for other services that you receive in your life. And that would bring the playing field back to being a little more level, that we would know ahead of time what our costs may be. But it also would give us an opportunity to shop around. It's difficult if you're in an HMO, you can't really shop around. But you can if you are in other types of insurance models. But it also may end up costing you less, even if you have an HMO, to know what that number is, to be able to call other places to find out what their numbers are, and create, if we're going to have an open market system, at least have some open competition then of who can, do that service for maybe a cash fee that would be less than maybe going through your insurance company.
Yeah.
Well, thank you, Kevin. Thank you for sharing your situation, and thank you for providing some thoughts on our existing system and where, as an average American, you would like to see the system move towards to make it more user-friendly for the people who have to use the system.
Absolutely. Thank you.
Also a guest today on the show is Melanie Estes, who also received some surprise bills. Thank you, Melanie, for coming and willing to discuss the experience that you had with a hidden cost to your health care. Can you describe what your first surprise bill was?
Yes, so I initially was going in for a procedure under anesthesia, and I went through all the pre-op and preparation and the doctor, meeting with the doctor, and then proceeded to have the procedure. And not until I got the bill on the back end did I find out that the anesthesiologist was actually out of network. So my insurance coverage only covered a smaller percentage for out of network physicians and care as they did for in network care. So I was stuck with a larger percentage to pay, and was not made aware of it until I got the bill.
And do you mind saying how much that surprise bill was for an out-of-network provider?
Yeah, so for that out-of-network anesthesiologist, it was about $1,500 additional out-of-pocket to me.
Oh boy, that must have been quite a surprise to um, not have revealed ahead of time the amount of money that you were going to owe. So once you received that, what course of action did you take?
Well, the first thing I did is after my initial frustration and upset, I called the insurance company and asked them what the protocol was for being made aware of that. And they essentially said there wasn't much that they could do, that I needed to talk to my physician and the provider. And so I went ahead and did that. And they also said that they could not tell me ahead of time who that might be, who that provider might be, other than the main surgery doctor.
So I understand that after you got that bill, and now you sort of are sensitive to the fact that out-of-network providers can be used on your procedures and not be revealed to you. So what did you do once you became aware of that, when you had a future procedure?
Right. So one of the things that I try to do now is I just ask the question, who's going to be involved in it, and can I get an estimate of what that might be? And however, on a following procedure, I wasn't able to get a clear answer. They basically said they couldn't really give me an answer to that clear enough to where I could make a decision. I do make emphasis now that I want in-network physicians working on me.
And when you made that request, did they cooperate with your designation that you did not want an out-of-network provider? I mean, what was their response to you designating that?
They really can't guarantee anything. It's going to be what it's going to be. And so that leaves it just, you're as the patient, you're kind of left a little bit helpless in that part of it.
Certainly takes away a financial decision on your part not to be allowed to choose in-network or out-of-network for a planned procedure, at least.
Right. Yeah. And when you think that you're with your doctor and you are going into a facility that is part of that healthcare system, they could slip in someone who happens to be available. It's the anesthesiologist.
So what would you suggest to people who are about to have a procedure? What do you recommend that somebody do to try to prevent that from having a financial consequence?
Well, I think the only thing that I do still, and I would continue to do, is just ask questions. Get as much information as you can. Ask the doctor who the anesthesiologist will be. Ask them what facility it's going to be at. Ask them, is that in-network and out-network? At least you may or may not get a clear answer, but at least you've given yourself the best chance to have a better outcome that you can control.
And perhaps have it on record that you request that no out-of-network providers be used in your surgical suite.
Yeah, good advice.
And so I understand you also had another surprise bill with a different scenario. Can you describe what that one was?
Yeah, so I was having an injection related to a health condition, and I went into the doctor's office, and a nurse's assistant gave me the injection. So
was it a nurse practitioner or a licensed vocational nurse,
no,
or
a
certified nursing assistant? Okay, yes. So more of a CNA. I just want to be clear, because billing for each one for a nurse practitioner is much different than a CNA.
Yeah, so it was a nurse's assistant. And again, I just went about my business, and when I got the bill, I was quite surprised by the cost, because I had my insurance at the time had a certain percentage that I had to pay depending on what that situation was. Mm-hmm. And I didn't understand why I would be billed 20% of the cost of it when it was nothing. I went to the doctor's office and I got a shot, as far as I could.
So as far as you knew, it was a nurse visit for an injection.
Yeah, that's the way I saw it. It was the fact. So I looked at the coding and I called and I asked what the coding was. And the coding was actually for a procedure. And a procedure to me is done by a doctor or someone certified and qualified to do a procedure. And so therefore I tried to say this is
And
not
how
a
mu-
procedure.
How much was the charge for having a CNA provide an injection to you?
My share was $900. And that's because it was coded as a procedure, so I had to pay 20% of that injection, which happened to be, fairly costly.
And did you have any satisfaction when you brought it to their attention that they were charging a procedure for a CNA providing you an injection?
Well, in that case, I brought it up to the doctor out of frustration when I saw the doctor. My doctor didn't have a whole lot of great answer and response to that. So I was only left with, and I told the administrative folks there that I wanted an estimate going forward of what the cost of what I was going to have.
Because I understand those were monthly injections.
Yes, and so I decided I wanted to have an estimate on that going forward. But as a result of that frustration, I basically ceased
And the
the
cost, I
treatment,
assume.
and the cost was a big part of it. I ceased the treatment and decided that the consequence of the situation was better than paying the $900 every month to deal with that situation. So.
Do you feel that your physicians are equipped to speak to you about billing practices?
No, absolutely not. When you ask about coding, when you ask about administrative type of things as it relates to what you're going to pay, they are not armed at all. You basically go talk to the billing department, go talk to administration. Oh, I didn't know that. Oh, I'm surprised by that. They seem as confused as the patient sometimes.
So if you could recreate the billing system around healthcare, what would you like to see in the perfect world of trying to eliminate these surprise bills?
Well, I think it's pretty simple. You can take your dog to the vet, and the vet comes in and gives you an estimate of what it's going to cost based on what they think the course of care is going to be. And you can make a choice based on that, and you understand fully. I mean, we do that much for, how we take care of our animals, and we have a choice in the matter of how much we're going to pay. It would be that simple to do that for ourselves, to be able to see what an estimate is going to be, so you can make that choice, and then you can you can change what that choice is based on what options a doctor might give you.
And do you feel that you know how much healthcare costs based upon billing that you get?
Well, other than it's really expensive, I feel like at least I would have a choice if I was given the numbers, and I would have the opportunity to ask questions.
Certainly ask questions before you get a bill, and certainly being ill and receiving a bill like that probably doesn't help somebody recovering from a procedure.
Yes, absolutely. Just adds to the pain and the frustration of trying to get better and to get through the situation.
So if you could tell somebody else who receives a surprise bill, what action steps do you think advice you would give for somebody who receives a surprise bill?
I mean, I would do just what I did. I think we have to be the squeaky wheel, and we have to call our insurance companies so they understand what's happening, what the practice is. And then we have to hold our doctors accountable, our administrative folks accountable. And it takes effort and energy, of which sometimes when you're ill you don't have. But I think it's kind of like someone breaking into your house. If you don't call the police and you just let it pass, the police are never going to know that there's a problem, and so they won't increase enforcement. Similarly, changes can't happen unless people believe and see that there's a problem.
Do you feel that you have enough skill to be able to decipher an explanation of benefits or the EOB that an insurance company sends you? Do you
No. That's one that's the start of it. So, you need experts around you, and there are resources you can call to get that information. But if you don't have enough to even ask the questions, you can't even begin to take advantage of those.
So certainly some simplification of the billing system may make the layperson better understand what they're paying for.
Yeah, you shouldn't have to search and ask for expertise to understand what a billing code is and what that billing code means. It should be pretty straightforward and easily accessible.
Thank you for sharing your experiences and your knowledge about, how you go about to try to even understand the billing process.
Thanks, Dr. Bucci.
To conclude with what we have learned from this episode is the different items of things that you can try to do to fix the surprise bill. The first would be to call the insurance company and get an explanation of the billing codes that were used and to get a clear explanation of why it was not considered to be a covered service. Then I would call the billing department of the health system that billed you for this and ask them the same questions: what billing codes were used, and if necessary, ask for a three-way call with both entities. You could request a recoding for them to go back into the medical records to make sure that the proper level of the service was billed for and that there was no upcoding or fee splitting, unbundling of the codes that were used. Then you could write an appeal letter for the denied services if necessary. And in the end, if you do not receive a recoding or an appeal being accepted, you can negotiate the cost, hopefully in a downward cycle or at least a payment schedule so that you won't be sent to collections. Some long-term solutions, things that should be discussed as we talk about healthcare within our country, is that we need to go back in time and we need to have fee schedules be published. Each health system should be able to produce their fee schedules so that we can get a clear idea about what our health care costs will be. The other one is trying to demystify coding. Most people cannot decipher an explanation of benefits or EOB that they receive from the health insurance company. And, people who are sitting and doing billing, called coders, go to school for this. It's a highly specialized area, but it has gotten so complicated that the average person cannot decipher a bill to decide what types of questions to ask. We should be having disclosures. If an out-of-network provider is to be used, that needs to be known prior to a procedure. It's not fair for us to not receive an estimate prior to receiving a service. As our guest said, everywhere else in our life we get estimates for services, and that way it does remove the surprise out of it, but it also helps us retain control over what we want to spend money for in our health care. So those are just some of the ideas, and certainly we would love to hear from you as to your experiences and any questions that you may have. Please direct them to our website and our email address. Thank you again, and please join us again for our series on Let's Get Real with What's Wrong with Healthcare.